Hi, my name's Jamie Barsky. I'm a clinical psychologist and the clinical lead for Anonymind, a clinical platform helping people with a gambling addiction. Today's video is all about the role of shame in someone's recovery from gambling addiction. Dealing with shame can be such a difficult and painful and yet important part of the process of recovery. And I know through my work with ex-gamblers just how much shame can be a part of their experience when they look back to their decisions and their actions when they were deep within their addiction. I know that gambling addiction can lead people to make decisions and act in ways that they regret so greatly when they look back. And shame can be such an understandable and yet painful emotion that's triggered when people think back to their past experiences. Ex-gamblers I've worked with talk about their lying, their stealing, their decisions that prioritise their gambling over their loved ones. And talking through that can be such a painful, difficult thing to do. And yet I believe that it's often an incredibly important part of the therapy process. Ex-gamblers have talked to me about how when they're in the throes of addiction, it's almost as though they're cut off from their capacity to feel shame. They act in ways and make decisions that should make them feel shameful at the time, or regretful or guilty, and yet it's as though they can't connect with that feeling. It's as though they're operating on autopilot. Or perhaps they rationalise and minimise their behaviours in an effort to reduce the emotions of shame and guilt and regret. That's what addiction does to people. And recovering from addiction can often bring ex-gamblers much closer to those feelings of shame and guilt. And that can be a really painful and difficult experience to go through. Shame, like all emotions, is there to guide our behaviour and communicate important things to us. The main communication message with shame is that we have done something that might result in us being rejected by other people because our behaviour has crossed a line. And that's why opening up and connecting with shame and allowing that feeling, that emotion, to drive us to reconnect with the people we think we've hurt can be such an important part of the recovery process. Sometimes people will need help to do that through therapy. Seeing a psychologist or therapist can support people to connect with their sense of shame in a safe way, in a manageable way, and then to use that connection to make decisions about how you may reconnect with the people you believe you may have hurt. It's also possible to work on these things independently without the help of a therapist. The first step in that is to open up your mind and open up your emotions to the experience of shame. The second step is to think about those behaviours and decisions that have made you feel shameful, and then to think about the impact those behaviours had on other people. The idea of that is not to punish yourself. You've been through enough pain and hardship with your addiction. But the idea is to help you think about how you repair some of the relationships that may have been harmed through your addiction in the past. Use the energy that shame brings, and all emotions bring energy. Use that energy to help you connect and repair those relationships that may have been harmed. If these ideas are interesting to you and something you feel you can pursue on your own, then go for it. However, if you think you may need some help with that, which many people do who are recovering from an addiction, please reach out to one of our clinicians on the Anonymind platform. We have psychologists and psychotherapists who are so experienced in working with painful emotions such as shame and helping clients to use those emotions to rebuild a life away from addiction. Thanks for listening and good luck.